Quarantines for vaccinated travelers arriving in Taiwan could be soon reduced from 14 to 7 days.
The Central Epidemic Command Center plans to test the vaccine passport program starting mid-May, allowing travelers to complete a shorter quarantine if other conditions are met. The details are still being finalized, but already health experts have raised safety concerns.
All along, we've been considering what kind of vaccine passport would be feasible and reliable.
The health minister said Monday that Taiwan will trial a vaccine passport program. Under the program, travelers will need to have been fully vaccinated a month before arriving in Taiwan. They'll also need proof of a negative PCR test before their departure and to later be tested for COVID antibodies. If those conditions are met and they test negative again on the 7th day of quarantine, they'll be allowed out of quarantine early at day 7 instead of 14. The program could roll out on a small scale mid-May, but one health expert fears it's too much too soon.
What's the concentration of antibodies that's needed to offer adequate protection? I think that still needs to be discussed. It would be best if there were an internationally recognized standard. We also need stipulation for the different types of vaccines. Also, Taiwan needs to develop a rapid antibody test. That's the only way to effectively reduce the chance of someone slipping through the cracks.
The doctor said that based on the current research, not all vaccines can produce a long-lasting and effective immune response. In addition, there have been cases abroad of people getting infected twice, the second time catching a mutated variant. These are some of the issues the vaccine passport program will have to resolve, he said.
A vaccine might generate antibodies, but those antibodies might be different from the ones found in people who have recovered from COVID. So what needs to be said is, some vaccines are better than others. If this vaccine passport treats all vaccines as the same, as in any vaccine counts, we then face another problem. Would the WHO approve China-made vaccine count too?
Health experts say that different vaccines offer different levels of protection. At present, the vaccine program requires only a certain antibody level without distinguishing between vaccine brand and country of origin. Officials said they want to make vaccine effectiveness their main metric, but that they're hashing out the program's details. Meanwhile, transport officials are devising new ways to improve interest in the Taiwan-Palau travel bubble.
Each PCR test costs 5,000 NT. You need one when you leave and another when you come back. So currently, we're discussing the possibility of subsidizing these PCR tests so that we can restore the cost of traveling to pre-pandemic levels. That might create more interest in traveling abroad.
The Transport Ministry is mulling subsidies to bring down the fees that come with traveling in a pandemic. Whether the subsidies will attract more tourists remains to be seen.